Okay, you were with me.
Welcome back to the House Committee on Government Operations and Military Affairs. It is Wednesday, February 15th, and we're here in our afternoon session to pick back up on the latest draft of the OPR bill. And I've asked Lauren Lehman from OPR and our alleged counsel to show us a walkthrough of the changes that they've made in the latest draft, which I'll direct the committee to on page is under Tim's name as draft 2.1 dated 2/15/23. Right. So would you both introduce yourselves for the record and take us through the new version of the bill?
Good afternoon, everybody. For the record, my name is Tim Devlin, Legislative Counsel.
Hello, my name is Lauren Lehman. I'm General Counsel for the Office of Professional Regulation.
So before you, you have draft version 2.1, which includes some updated language that marks some substantive changes from the last iteration that we walked through before last week. The dates are slipping from my mind. In particular, it builds out some sections to do definitions of pharmacies, some notary language, and perhaps it's best just to kind of jump into it. I should also note that all the changes have been highlighted so you can clearly see the distinction from the new language versus the old. Starting at the top, I just reworked the statement of purpose that was introduced to reflect the new changes. And we'll just kind of continue further down. Let's jump to page. Sorry, I should ask the chair. Would you like me to, I presume, just jump to the new?
Yeah, to the changes. So and if you could just say like if you want to just say there are no changes to the misconduct section, et cetera, that would probably help kind of jog people's memory. So maybe we'll just say if there hasn't been a change, just reference the section and then we'll jump to the changes.
Okay, I'll just go through referencing what hasn't changed and then dive into what has changed. The first part regarding the Office of Professional Regulations, that has not changed. That includes section 1. Sorry, I'm just going through here. Sections 2. The second part regarding barbers and cosmetologists, including section 3, has not changed. Language in the next part regarding osteopathy, section 4, also has not changed. Getting to the first part which has changed on page 8 under the part regarding pharmacies. In section 5 under definitions, there is an additional change made to definition for pharmacy technician. And this has to do with, well, I'll just read through it and then I can let Attorney Lehman kind of unpack some of the substance here for you. She's much more an expert in the technical meaning behind it than I am. Starting on page, line 6, item 14, pharmacy technician means an individual who, only while assisting and under the supervision of a licensed pharmacist, performs tasks relative to dispensing prescription drugs, administering immunizations, and performing tests for SARS-CoV. Pharmacy technicians shall administer immunizations and perform tests of SARS-CoV in compliance in accordance with section 2042A of this title.
Any questions? So to give context, we spoke briefly about this last week, that there's that federal authorization for pharmacy technicians to provide immunizations and do limiting testing for COVID. And this expands the existing authority for pharmacy technicians in Vermont law, which was limited to dispensing period under the guidance or under the supervision of a pharmacist. This would expand that role to include those PrEP Act authorities that are expiring. So we're expanding from just dispensing to now being authorized to administer vaccines and test for COVID. in accordance with some things that Tim will walk through.
That concludes all the changes made to this section. The subsequent section, section 6, also has no changes. Jumping down to section 7 at the bottom of page 9, we have Title 26 VSA, section 2042A is amended. And this pertains to pharmacy technicians again, specifically qualifications for registration. This adds in a new subsection B and C, and D, I apologize. It breaks over the next few pages. And I'll just read it verbatim. Let's see, starting at the top of page 10, line 1. The now new subsection A, this is old language, but it has now been redesignated. No person shall perform the duties of a pharmacy technician unless registered with the board. To obtain a registration as a pharmacy technician, an applicant shall. Section B, pharmacy technicians administering an immunization shall meet the following requirements. 1, hold a registration as a pharmacy technician in accordance with subsection A of this section. 2, hold a current CPR certification. 3, have successfully completed, there's a typo there, an accreditation council of pharmacy education accredited program, training program approved by the board. And 4, successfully complete 2 hours of immunization related continuing education approved by the accreditation council for pharmacy education every 2-year licensing period. New subsection C. Pharmacy technicians shall only administer immunizations, 1, to patients age 18 or older, 2, pursuant to schedules and recommendations of the advisory committee on immunization practices recommendations for the administration of immunizations, as those recommendations may be updated from time to time. 3, breaking into page 11 here. When a licensed pharmacist who is trained to immunize is present and able to assist with the immunization as needed. 4, that are recommended by the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices, or ACIP. And 5, that licensed pharmacists are permitted to administer under the state clinical pharmacy protocol as established in subdivision 2023B2 of this title. New subsection D. Pharmacy technicians performing SARS-CoV tests shall do so only, 1, when a licensed pharmacist who is trained to perform SARS-CoV tests is present and able to assist with the test as needed. 2, in accordance with the state protocol adopted under subdivision 2023B2AX of this title. And 3, in accordance with rules adopted by the board. New subsection E, I apologize, I forgot to mention this above. The board may adopt rules regarding administration of immunizations and performance of SARS-CoV tests by pharmacy technicians. I'll pause there.
Before we get to questions, I just wanted Lauren to give us the context and then I'll open it up for the committee on the section.
So I'm noticing a couple of redundant elements here that I think we'll need to address. I think previously there had been another subsection between 3 and 4 that specified these were the types of immunizations they could provide, only those recommended by the CDC, ACIP, and only those that licensed pharmacists are allowed to provide. So the way it was structured is, again, we're talking about so we expanded the proposal was to expand the scope of practice of the pharmacy tech by expanding the definition of what they could do. And then this portion puts limits around that practice. So they can administer immunizations, but only if they meet these qualifications and in these contexts. So this is intended to lay out those qualifications in context. The first part is about what the pharmacy technician needs to have in order to be qualified to provide those immunizations. So that's part B there. And 1 through 4 provide those qualifications. Part C is supposed to be about to whom and how they administer those immunizations. So they can only provide them to patients over 18. They can provide them in accordance with the schedule and recommendations of ACIP, and they can provide them when a licensed pharmacist is present. There's supposed to be another subsection here that would be a new part D that would be what vaccinations can they, or what immunizations can they provide? So we've gone through qualifications, to whom and how, and now we're at what immunizations. And they could, the proposal would be that they would only be permitted to administer those immunizations recommended by ACIP, and only those immunizations that licensed pharmacists are permitted to provide. So that concludes the immunization portion. Next portion, part D, is specific to the testing for COVID. The references here are I think part D1 is self-explanatory. Part D2 is reference to that state protocol we talked about a little last time too, is there's a protocol in the chapter that allows clinical pharmacy practice by pharmacists for only those prescriptions and examinations, those medications and examinations that the Commissioner of Health signs off on in consultation with the Director of OPR. So we had birth control, flu tests, or immunizations, tobacco cessation, a number of things. There's also a provision in there that says in a CLIA exempt facility or pharmacy, a pharmacist can do COVID testing. And this extends that authority to perform those COVID tests in a CLIA approved setting or exempt setting and in accordance with that state protocol, so approved by the Commissioner of Health, for pharmacy technicians to do that testing as well. And I think that's explanatory. There's also an opportunity for the board to establish rules if there's more in the weeds questions or practical decision-making to be done around those limited immunizations and testing. Good, thank you.
I knew if we had OPR, we probably would get most of the committee's questions answered. So thank you, Lauren and Tim. I appreciate the tandem testimony because it really helps put the language into context. So did I hear you say correctly, there's that one more piece of just specifying which immunizations are covered by the first half of this piece is going to be added probably in a future draft.
That's what OPR would request. We will defer to our ledge.
That seems to make sense. I think it may be redundant given the structure, but we can kind of work offline and make sure we've got all of the I's dotted and T's crossed in the next draft of the bill. Any questions on the words on the page on this section? Representative Morgan?
I think you caught it, Tim. I think I heard you say typo, right? Ted, I think I heard you say it. Anyway, but thanks.
Got evil eyes on this committee. We're not going to let any typos get. Great. That's it for that section, and then there's one more new piece.
Yes, skipping sections 8 and 9, which there are no amendments to. There's a new part regarding notaries, new section 10, which amends Title 26 VSA section 5361. And this section heading is notarial acts in the state, authority to perform. And this is a slight modification to a cross-reference in statutory, and the section reads as subsection A, a notarial act as defined in subdivision 5304, subsection 10 of this chapter may only be performed in this state by notary public commissioned under this chapter.
The legislature updated the notary statute significantly last session, and we missed one of the updated citations in the original language. So a friend caught that and pointed it out that we're pointing to the wrong definition there. So we've updated the citation.
And is Representative Higley, I bet you're going to ask exactly what I was going to ask.
Go ahead, because this is on a different.
Oh, you're on a different piece. I just want to say, is it referencing the definition of a notarial act? Okay,
Now it is. It wasn't before, it wasn't with the old citation, but now it will be.
great. Representative Higley.
I just want to go back up to the other piece on pharmacists administering vaccinations. Are they going to be required, the same as doctors, to report adverse effects to the vaccine adverse event report system?
Yes.
Okay.
Anything else, Laura and Tim, we should know before we hear from our witnesses on the bill who've been very patient with us, adding some new language here?
Nothing for me. Thank you.
And that concludes all the new changes.
Great. Thank you both so much.
Thank you.
Great. So now we're going to hear some testimony on the OPR bill. Stephanie Winters, I have you as our first witness. So please step up to the hot seat. Thanks for being with us today.
Hopefully not too hot.
No, I think this is a much cooler hot seat than it was this morning.
All right, good afternoon. Thank you for inviting me in to testify. My name's Stephanie Winters. I am the Deputy Director of the Vermont Medical Society, but the Medical Society is the administrative home for a number of specialty societies. So I may come in with different hats on, and today I have two hats on. So for the Medical Society and then the Vermont State Association of Osteopathic Physicians and Surgeons. So again, thank you for having me. I want to thank, first off, I want to thank the Office of Professional Regulation and the Board of Pharmacy for seeking our feedback and including us as a stakeholder in their protocol process. I've been able to make almost all of the Board of Pharmacy meetings and has really been an inclusive process. So I want to thank both of them, and really it has been an opportunity to work collaboratively to ensure both patient safety and increased access to care. So upfront thanks. Today I'd like to comment specifically about the sections in the OPR bill relating to osteopathy and pharmacy. The proposed change in section 4, and I didn't see the new bill, so these subsections may be a little off, but change in subsection 4, subsection C, remove the requirement for osteopathic physicians to get 40% or 12 hours of osteopathic specific medical education every 2 years. So the osteopathic physicians in the state strongly support this change. And just to sort of review that osteopathic physicians or DOs have equivalent training to MDs and in most cases practice in the same way. The requirement to have osteopathic specific education was arbitrary at best, and I'll explain a little bit about why I say that. And did not necessarily provide osteopathic specific information. For example, the state organization, so the Vermont State Association of Osteopaths, has a conference every year. We apply for continuing medical education through the National Osteopathic Physician Organization, so the AOA. And the only real requirement is that you have X percent of DOs present. Not about the actual material that you are presenting on. So that is considered osteopathic specific, but it really has nothing to do with the practice of osteopathy. That's why I say this was an arbitrary requirement. So this would, that is why we would support this change. In the next section on pharmacy, the Vermont Medical Society supports the creation of a protocol for pharmacists to provide subcutaneous Depot-Medro. I practiced this so many times and I had it right. Depo-Provera Yeah. VMS actually suggested this addition to the Board of Pharmacy in our March 2021 comments during the self-administered hormonal contraceptive protocol drafting. And, just to say that Depo-Provera is safe and effective, and we support any instance where we can safely remove barriers to accessing contraception. The American College of Obstetricians and Gynecologists, or ACOG, states that Depo-Provera injections, along with other contraceptives, are safe and should be widely available. Since this is already current practice in some pharmacies, VMS also supports the creation of a protocol for pharmacists to administer vaccinations recommended by the Advisory Committee on Immunization Practices, or ACIP. And administered consistently with ACIP-approved immunization schedules for patients 18 years of age or older. And we look forward to continuing to be involved in the protocol process and providing feedback. So again, thank you for inviting us, and I'm happy to take any questions.
So just wanted to say, would it be safe to characterize that VMS and the Association of Osteopathic Physicians and Surgeons are supporting the bill, these specific sections that you referenced pertain to?
Yes, and the caveat is I haven't had a chance to look through the new text, but
VMS unlikely to care about the notary definitions, new section.
Although I stopped being a notary, no, just kidding. Yes, those are the only sections we are talking about today.
Yeah, so the new language does, it does really spell out in much greater specificity the conditions on pharmacy technicians administering immunizations and tests.
Yep.
That I would say is the bulk of what we just heard as a new section. So if you do have feedback on those after getting a chance to read them, please feel free to get in touch with the committee.
Absolutely.
I think this bill will move pretty fast, so maybe do that today or tomorrow morning. But would definitely invite any feedback on the most recent language. Questions for Stephanie from the committee? Thank you for being here.
Thank you.
All right, and coming in remotely, Sandra Rosa, excuse me. It's already been a long day.
I expected that. Thank you very much for having me, Mr. Chairman, and the committee, and a special shout out to my representative, Mike Morgan. I represent the Vermont Pharmacists Association, and we agree with the proposed legislation that was read off today. We are in favor of increased access to hormonal contraception, and we are pleased to work with the Vermont Medical Society in achieving that. We just want you to assure you that we are properly trained, and we're also properly trained to determine eligibility and defer to primary care physicians, so that it's not a free-for-all, as it were. Regarding the immunizations of over 18 by pharmacists approved by the CDC and ACIP. This is something that we've been doing for a long time, but during the emergency use authorization, we were allowed to vaccinate for patients over 3 for immunization, influenza and COVID, and additional shots and immunization. We'd like to have you consider that. That was given to us, emergency use. It's going to expire in May. But for your information, the American Pharmacists Association, which is our national organization, has asked the Department of Health and Human Services to continue this authorization so that there will be more access. Getting children their flu shots can sometimes be problematic, especially if they're not anywhere close to a wellness visit. And this would put less strain on the pediatricians. We also will, of course, notify pediatricians as to, any shots being given, and the immunization registry, so that everything is accounted for. And are we still? I didn't hear us discuss Section 7. Is that an appropriate time to do that now?
Oh, yeah, absolutely. I'd be happy to get your feedback on any parts of the bill. And the new section 7, the pharmacy technicians, that's in draft 2.1. Is that what you're looking at?
No, I'm looking at the pharmacist in charge requirements.
Yeah, do
Section
those.
7, C.
It's,
The new way,
yeah, so this is the new,
oh, that's registration and licensure.
Yeah.
It has to do with, apparently it looks to me as if the 1 year requirement of practice, being in practice as a requirement, has been removed. The Pharmacists Association is not in favor of this. It's a dangerous threat to patient safety. Newly licensed pharmacists are not sufficiently trained in the workings of pharmacy management to assume the many duties required by the pharmacist in charge.
so I think our understanding, I just want to get clarification before we get too far into this, was that this was a 1 year, the requirement to have an unrestricted license in terms of, any flags on the license was what we're talking about, not necessarily new pharmacists. So I'm wondering if
I was under the impression
on that particular piece before we get too much farther.
I was under the impression that it was crossed out that they had to have at least 1 year of pharmacy practice experience in order to be a pharmacist, supervising pharmacist, and of course have an unobstructed license. All of that is important. But that 1 year requirement that we're referring to.
Yeah, if you wouldn't mind, I want to invite Lauren to testify or just on that specific piece and just clarify for the committee what the intended effects of that piece is, because it was my understanding that it wasn't about new pharmacists, it was about the restrictions on the license. So could you clarify that for us?
Certainly. This is Lauren Lehman, OPR General Counsel, again, for the record. So it would remove what is existing, the 1 year requirement for licensure before being eligible to be a pharmacy manager. Obviously would be unrestricted. So it would permit new pharmacists to become managers. We would defer to the facilities and the pharmacies themselves to determine whether somebody were qualified to be a pharmacy manager after that time. And there are, unprofessional conduct provisions that prevent somebody who's unqualified from performing certain duties from undertaking those. Now, that all said, we have pharmacy rules that are in this journey, and so we've been working with stakeholders for the last year, including the board, about this. And so this requirement was removed in the rulemaking process. We've spoken to stakeholders and everybody seemed amenable to it at that time. If there's a further discussion, we can have that, and we're happy to reconsider as well.
Okay, Representative Hango, you.
Yeah, I thought the last version of this that I saw, because I remember talking about, so one day, I remember saying 1 day after 1 year, you can then become a pharmacy manager. And the answer to that was yes in testimony. So I don't remember seeing this crossed out. Did I miss something?
Yeah, Section 8 hasn't changed at all. The new Section 8 is the old Section 7.
I don't.
I'm trying to remember. I know we talked about it. I just don't remember.
I know I asked that question. I was told, yes, 1 day after 1 year, you can become a pharmacy manager. Look back in my notes and see.
I believe that is the case today with the 1 year restriction.
I believe my recollection of the discussion was 1 day after getting licensed, they could.
Yeah, I don't think.
But again, it would be deferred to the pharmacist, see if it's determined.
Okay, so and thank you for indulging me. I just wanted to make sure we were all on the same page there. So your concern is about that particular section is noted, and we will dig into that a little deeper before we move the bill along. Representative Morgan.
Yep, sure, thank you.
Thank you.
Sandra, so you're just saying real quick, you would be in favor of leaving that there, not having it struck out. You want a year and a day
Yes,
as a minimum to be a manager and from your perspective, to be.
Yes, sir.
That's where, not,
Yes.
but not a different period, 2 years, 3 years, but 1 year works for you. That's
Yes,
all
sir.
to clarify with her.
Yeah, so the position would be to just leave the language and statute as it is and strike that section.
Not have the strike in it.
Right.
In essence.
Yeah.
Yeah.
Okay, we'll put a big question mark on that. Need to, thank you very much. Please continue your testimony. Sorry for the interruption.
That's pretty much it. That was our main bone of contention. We're very pleased with the language that is and the cooperation that we've had all along. So I want to thank you very much for your attention. And thank you for looking into this little quirk. I think it would be in the interest of patient safety to leave the original intent of 1 year on books. Thank you so much.
Thank you. And I also wanted to say, I think that the new section 7 that is in draft 2.1 that we just heard a little earlier has those specific language for pharmacy technicians and the conditions for them to administer immunization and testing. And so if you do have any feedback about those sections, if you want to take a look, feel free to email us. Andrea Hussey, our committee assistant, her email's on the website. I think you have it from the scheduling too.
I do. Thank you very much. Yes, we're very much in favor of it. It's been going very well during COVID, and we'd like to continue that particular aspect.
Thank you for being with us, and feel free to stick around. We also have Jeff, how do you say your last name?
Hochberg.
Hochberg. Thank you very much. So thanks for being with us. You're with the Vermont Retail Druggists?
Yes, thank you very much. Again, for the record, my name is Jeff Hochberg. I'm the president of the Vermont Retail Druggists. I'm also the owner of the Smile and See Pharmacy Group, which has 6 independent pharmacies in the state. That's 6 out of the 16 remaining. Just and for I'm going to make this pretty easy. With echo Sandy's comments and that of the board, we are largely in support of the expansion of pharmacy technicians and their services. This is going to put Vermont in alignment with many other states, particularly even New Hampshire, who have already done this kind of work, making the pharmacy technician more utilitarian in the pharmacy practice as the role of pharmacist is expanding. I will make a quick comment about the kind of one issue that I do see with this is we're making a big effort here to get pharmacists to be able to administer COVID tests. Just so you know that if you were to go to one of my pharmacies through the drive-through, get a COVID swab for a PCR test, that same one test swab could also test for influenza and RSV all at the same time. Why we're limiting it to COVID when we saw such a great performance of that testing capability at pharmacies, that's something to be discussed. I do believe there is a House bill coming down that echoes what the state of Delaware did and really looking to propagate the pharmacist testing abilities within those CLIA waive sites. So I believe that's coming out in another drafting request. So you might see something that's very familiar to this.
And then just for clarity for us, so that's at the federal level, there's legislation or here?
There is legislation at the federal level as well, but there's legislation within the state of Vermont. There's legislation coming down, I believe from House Healthcare, correct me if I'm wrong, about expanding the point of care testing capabilities of pharmacists. So that a lot of these very quick assessment tests in Delaware, using Delaware as the model, Delaware last year approved strep testing, A1C testing, cholesterol testing, HIV, Hep C, all of those things. There's now a lot of capability and tools that make these assessments very quick and easy, and the pharmacy seems the best suited to handle maintaining high access to those. So that was a switch many states are turning on. And hopefully we'll see something similar in Vermont, so. I'm going to echo too what Sandy said about the 1 year requirement. I would never, ever, ever hire a pharmacist in any of my stores that is a new grad and put them in charge. There's way too much learning that needs to be involved, that needs to occur before you are in charge of patient safety and responsible on behalf of all the pharmacy staff. So we are firmly against that. There is not a shortage of pharmacists in this state. So if you hear that, that's a big common misconception that's being propagated nationally by some players. It's not true. You have a lot of pharmacists unwilling to work in bad environments is more appropriate. So it's the pharmacy technicians that are we're having difficulty, supporting our pharmacists, which is why we support the expansion of the pharmacy technician roles. Those that we've trained over the years, that have gone through certification tests, that looking for a career path. It's great to see them included in the expansion capabilities. So we support that. And then I wanted to touch briefly on the general context of pharmacy today. As I said, there are 16 independent pharmacies left in the state. 10 years ago, we had over 30. You have the chains who are there's issues going on about public safety in the news. There's consolidation within those chains. There's consolidation within the wholesaler market. If the state of Vermont ever truly wanted to tackle prescription drugs from pharmacy top down, cost, insurance, patient safety, you need to take a hard look at how we do business in this state. It's not this great system. It's not transparent. I always like to throw out, if you really want to do pharmacy right, you should run it a lot like we run liquor control. It makes a lot of sense. It would make it transparent in terms of cost, makes it easy to regulate. You have the board of pharmacy there for patient safety. All of that maintains, but you eliminate the insurance burdens, complications that we're seeing today. So food for future thought, not something you want to discuss here in this bill.
That level of healthcare reform and marketplace change is definitely not in the jurisdictional wheelhouse of this particular committee, but I really appreciate that.
I would suggest,
But the DLL overlay is a concept.
That is.
in an ideal world, if you were to ask me today, as I'm the largest independent in the state, what I would suggest to you is that the best way that pharmacy should run in this state is a public option pharmacy outlet. And to get there, you have to start with a state-run single wholesaler. There actually is a bill coming down for that. So it is very much in line with kind of a future thought. If you want any examples of how successful it is, I only need to turn you to Mark Cuban, who has successfully doubled the share price of drug cost drugs, which does exactly the same thing, but for a private entity. So why can't we do it as a government? In a small, brave little state like Vermont, with 16 independent pharmacies left.
I was joking before we switched gears and got on the OPR bill that our testimony this afternoon was not going to be as spicy and exciting as it was this morning. And Jeff, you had just completely.
We just want to control state pharmaceuticals.
I want to try to get back onto the bill that's in front of us. But with that said, Representative Morgan.
Real quick. So first of all, I've never seen somebody come into committee that's so emphatic about their vocation as a computer that you're a drug dealer, but that's great. You're a legal drug dealer.
Exactly.
But no, all kidding aside, it appears, I think I'm watching Sandy's body language, you all appear to be more or less on the same page.
Yes.
Yeah,
absolutely.
That's good to hear.
Absolutely.
Okay, thank you.
Any other questions?
Are you looking to buy any health insurance companies?
Am I looking to buy health insurance companies? No.
So I hear that some
Health insurance companies do not like this guy. I have been the lobbyist for Vermont Retail Drugs as the president, been acting as president for over a decade now. Literally that same pitch about single wholesaler. It's been happening since 2013. The industry you're going to see a lot of problems in pharmacy, particularly in the next 18 months. This is the major pinch point for community pharmacy, certainly in rural areas. You're hearing the term pharmacy desert crop up across the country. Vermont is not immune to that. Again, we have 16 independent pharmacies left in the state, 3 major operating chains. Grocers are actually getting out of the business entirely too. And you have the FTC investigating vertical monopoly potentials in this space. You have OIG investigations. We have an active OPR investigation. It's a mess and it's crumbling. And we need to have a solution before it gets out of hand, quite frankly.
No, I appreciate that. And again, I mentioned it just out of jest in a sense. But I do hear that some of these larger chains, like you say, are getting involved in.
Yeah. It'll be interesting. The next 18 months, because we have so much reform going on. We had a successful bill passed last year. DFR is taking the reins on a lot of the jurisdictional questions that have been at large. The FTC investigation, there's an upcoming DIR reform, which I won't even try and explain DIR clawback fees at this point in time, but needless to say, there's a federal reform that goes into effect January 1 of 2024, at which point this is supposed to create some more transparency and end these practices that are, again, hiding dollars in the industry. The price you pay as a consumer at the counter is not the price you should be paying. Period.
Forward to working with our colleagues on House Healthcare on some of these issues. Yeah. Representative Hoover.
Maybe a further diversion. PBMs.
PBM?
Pivotal in that?
Huh?
Pivotal in that cost discussion?
Oh, PBMs. You have 3 Fortune 15 companies that run healthcare in this country. Okay, you have Cigna, CVS Caremark, and Express Scripts, which is owned by Cigna, and then Optum RX, which is owned by United Healthcare. So you have these entities that operate as insurer, PBM, retailer, wholesaler in some cases, which is why it's garnished the attention of the FTC. There's problems, big problems.
Thank you,
my pleasure,
Jeff, for illuminating the challenges in the consolidated healthcare environment in which you are representing Vermont independent retailers. So lots to think about there. So we have one more witness that's scheduled for 2:15. I might suggest that the committee take a break a little early. I'd like to confer a little bit with OPR and ask them to come back and weigh in on some of the questions around the old section 7, which is the new section 8, which appears to be the one sticking point so far for us. If it's okay with the committee, do you have a question, Representative Rowe?
I just wanted to let you know at 2, I'm going over to Probst to hear a presentation.
Okay, great. We'll fill you in and touch base.
I'm showing 2:30 on here. Has that changed?
No, that has not changed.
Yeah, the theme was break.
So he's back at 2. He's available at 2:30. Okay, great. So we'll come back and hear that last piece of testimony at 2:30. So we'll take an extended break here and try to get some